Good morning, and welcome to part 2 of our 3-part series for nutrition counseling for the Aging Network. Today we will discuss referral methods, telehealth, and billing. On behalf of the National Resource Center for Nutrition and Aging, we thank you for being here today. So who am I? My name is Jocelyn Evans, and I'm a registered and licensed dietitian. I'm also certified in gerontological nutrition. I am currently a consultant dietitian with the National Resource Center for Nutrition and Aging. I have 5+ years of experience working with the older adult population, both in long-term care and the community setting. Let's first discuss some of the preferred referral methods for nutrition counseling for older adults. Some of the best practices that are used around the nation include developing a priority screening utilizing your participant registration or intake form. Participants that screen for high nutrition risk on a screening such as the Determined Checklist, or also for needing assistance with activities of daily living, would be a good start. If your area agency on aging has an Aging and Disability Resource Center, information and assistance staff, and/or case management staff, consider hosting quarterly training sessions with a registered dietitian to know what nutrition counseling is and how to refer individuals to the dietitian. Included in the PDF versions online include sample scripts for call center and referral staff. Other screening questions could be included in the registration process, such as for food insecurity and malnutrition. Additional best practices could be connecting with evidence-based programming. You may offer nutrition counseling after these classes. Program leaders can provide information regarding nutrition counseling at the end of the programs. Also, creating an incentive for current participants to provide referrals. Some examples could include gift card or coupons for other businesses, a quote-unquote free meal to the congregate program, or other free goodies that you may have had donated or purchased. When looking at referrals from hospitals or clinics, here are some helpful tips. Scheduling an appointment to meet with each of the local providers in the area. Developing a referral program or process for the providers to contact you for referrals. This could be via email, electronic health record, or a phone call. Dropping off a gift basket with business cards or flyers of AAA services, including nutrition counseling. Following up with the providers periodically to show appreciation for referrals and reminding them of the services offered by your organization. Also, determine the services that the hospital or clinic can offer as well. This can promote strong partnership. Meeting bi-monthly with the providers to continue to audit referral program or the process to see what can be improved or changed. Another possible area for referral could be your local grocery store and/or pharmacy. Check to see if your local grocery store employs a dietitian or has a pharmacy in store. If there is pharmacy staff or a dietitian, make contacts for referrals. The grocery store staff or pharmacy staff may also refer the client to the Aging Network programs for services. Be sure to develop a referral program for the staff to contact the Aging Network for referrals. This could be via email, electronic health record, or phone call. If the local grocery store does employ the dietitian, you may also contract directly with that dietitian to perform nutrition counseling. Here are some possible diagnoses or problems for the pharmacy staff to refer for. One could be diabetes or poor glucose control, possibly a new diagnosis or an increase in the insulin or diabetes medication. Second, hyperlipidemia or heart disease, possibly a new statin medication. Any weight issues, either obesity or underweight. Dialysis or chronic renal disease. And also any food allergies or intolerances. This is an example put out by the National Recreation and Park Association regarding increasing referrals to community-based programs and services. This is included in the PDF version of Nutrition Counseling for the Aging Network. Now let's switch gears and discuss telehealth. According to the Health Resources and Service Administration, telehealth is done primarily online with internet access on your computer, tablet, or smartphone. It allows the doctor to provide care for the client without an in-person visit. Options for telehealth care include talking to the provider over the phone or video chat, sending and receiving messages from the provider using messaging or email, and possibly using remote monitoring so the provider can check on the client from home. Be sure to check if telehealth is included in the RD's liability insurance before utilizing. If the dietitian plans to bill insurance, be sure to check specific requirements related to telehealth services. It's important to keep in mind that clients may feel more comfortable with a telephone consultation instead of a video or even in-person consultation. A telephone consultation could be an option for a client who does not have the appropriate technology for a video conference. Keep in mind, however, that rapport may be more difficult to build via telephone than on video or face-to-face. If telehealth plans to be used, here are some HIPAA-compliant platforms. It's important to note FaceTime, Skype, and text messages are not HIPAA compliant. Be sure that we are always following the best practices as we would with an in-person consultation. Now let's discuss billing and reimbursement. So how will the consultations be paid? Here's an example funding guide that you can use. First, check to see if nutrition counseling is eligible to be covered under Medicare or Medicaid. If that is not an option, you can also look to see if the client's private insurance reimburses for nutrition counseling. After those two are exhausted, looking towards Older American Act funds along with voluntary contributions would be the next step. If Older Americans Act funds are not an option for nutrition counseling, private pay may also be an option. So we know that Medicare nutrition counseling benefits are often underutilized and represent an area of revenue opportunity for community-based organizations. As of 2020, Medicare Part B may cover medical nutrition therapy services for diabetes, kidney disease, and a recent kidney transplant. Medicare covers 3 hours of MNT the initial year of referral and up to 2 hours of MNT subsequent years. Be sure to check on the Medicare requirements for telehealth when filing the claim. In order for the dietitian to be reimbursed for nutrition counseling services, the registered dietitian must be an approved Medicare provider. So what will nutrition counseling be reimbursed at? Every year, the Centers for Medicare and Medicaid Services release the calendar year physician fee schedule. The physician fee schedule lists payment rates for physicians. By law, registered dietitians are paid 85% of the physician's rate. Medicaid. Medicaid may also cover nutrition counseling through an elderly or health and disability waiver if the consumer is on Medicaid. Look into state Medicaid profiles to see which Medicaid programs may cover nutrition counseling. Some Medicaid providers also cover post-discharge meal programs, such as the Humana Well-Dine Meal Program. Private insurance may also be used as a funding stream for nutrition counseling. This will be specific to the insurance company and plan the individual has. With all of the funding streams, determine whether the AAA or the dietitian will organize the billing process. The next funding stream we discussed was Older Americans Act funds. With Older Americans Act funding, voluntary contributions should be encouraged. Contributions can also be accepted online on your website. Some verbiage to use could be, if you found the service to be beneficial, please consider donating an amount you are able for the program to continue providing these services to the community. All donations are voluntary. We thank you for your support. It's also important to note that the dietitian payment should be determined between the dietitian and AAA staff to reimburse the dietitian time. Be reasonable when determining appropriate time needed to complete all aspects necessary, including marketing, pre-consult preparation, actual consultation time, and post-visit charting. Additional materials. The PDF version of the nutrition counseling guides for the Aging Network and the registered dietitian are available on the website at www.acl.gov/seniornutrition. This concludes part 2 of our 3-part series of Quickeners on nutrition counseling for the Aging Network. Part 3, we will discuss marketing and highlights around the nation. See you then.